Good day, I'm Lorraine Mendez, and this is your JIS News for Tuesday, March 16. Jamaica is the first country in the Caribbean to receive COVID-19 vaccines through the COVAX facility. On Monday, 14,400 doses of the AstraZeneca vaccines arrived on the island. This follows on the heels of last week's delivery of 50,000 doses, a gift from India.
With these additional doses, Jamaica will continue to administer vaccines to the priority groups as outlined in the vaccine plan.
The priority groups include healthcare workers, members of the Jamaica Defense and Constabulary Forces, as well as persons 60 years and older.
This delivery is part of the first phase of deliveries for Jamaica, and more vaccines are expected to arrive successively during 2021. According to the first round of COVAX allocations, Jamaica is expected to continue receiving doses through May until it reaches 124,800 doses, the amount specified by COVAX.
Every dose arriving in Jamaica brings the promise of protection for many more families from COVID-19 infection. Over time, this will bring the pandemic to an end and reduce its harmful secondary impact on children.
The COVAX facility is a global effort between the Coalition for Epidemic Preparedness Innovations, Gavi, the Vaccine Alliance, UNICEF, the Pan American Health Organization, and the World Health Organization. COVAX seeks to provide vaccines for at least 20% of the population in each participating country in 2021. Occupants of infirmaries and nursing homes, as well as those who administer care in these institutions, have been added to the priority list for vaccination. Persons in this group will start receiving doses of the vaccine this week.
A lot of our vulnerables and very vulnerable persons reside in our infirmaries, whether private or public. They are the ones with significant comorbidities, who are older, 60 and over. And indeed, if you look at the history of our infirmaries in other jurisdictions, we've been lucky here. Not just luck, we've worked at it. The truth is, a lot of deaths have taken place in infirmaries throughout the world once the virus touches down in those institutions. The spread is fast and the impact is devastating.
Health and Wellness Minister Dr. Christopher Tufton says vaccines will be administered to parliamentarians who are 60 and older this week. Uniformed groups, including those stationed at sea and airports, will also be inoculated in the weeks to come. 12,099 persons, or 71% of the targeted priority group, have already received their first dose of vaccines. The vaccines were administered between March 10 and 14. Still on health, Portfolio Minister Dr. Christopher Tufton says contingency plans are in place to administer COVID-19 vaccines to persons in the priority group who are not healthcare workers or members of the security forces. Minister Tufton shared that persons in the 60 age group and older are given doses to prevent wastage. This, as once opened, the vial, which contains 10 doses of the vaccine, has to be used within 6 hours.
The plan does cater to persons who are at home and not mobile because of age or restriction. And where we have to go to persons who need a vaccine, we will do that because the plan does have a mobile component.
Dr. Tufton was addressing the weekly virtual COVID Conversations press briefing on March 11. Dr. Tufton said the process of registration and appointment for some 350,000 persons 60 years and older to receive the coronavirus COVID-19 vaccine will be facilitated through the ministry's 888 One Love toll-free number, as well as its website, among other means. In other news, Cabinet has approved the transfer of the portfolio of the Micro-Investment Development Agency MIDA to the National Export-Import Exim Bank. The MIDA portfolio will be managed as a concessionary revolving loan program for productive micro-enterprises.
In recent years, MIDA had increased its lending to the micro-productive sector due to the positive spin-off from supporting value-added enterprises. Several steps were taken towards winding up the MIDA in keeping with previous decisions of Cabinet to modernize and streamline public bodies.
The agency's functional mandate as single staff member and fixed assets of the entity will be transferred and managed by the Ministry of Industry, Investment and Commerce in keeping with standard asset management practices. And finally, the Registrar General's Department is reporting that it has maintained its 98% registration of births at hospitals and birthing centres across the island. Chief Executive Officer Charlton McFarlane says this is as a result of the introduction of new bedside registration protocols since the onset of the COVID-19 pandemic. Mr. McFarlane says the protocols include making changes to the collection of birthing information by RGD officers located at hospitals and birthing centres. This, he says, was communicated to the CEOs of hospitals and the Ministry of Health and Wellness.
To ensure that the new protocols are facilitated as best as possible. In particular, for mothers who are COVID positive, but are also giving birth at the same time, clearly those mothers would be isolated in specific sections of the hospitals. What we use in those cases is what we call the notification of birth, which is information that is placed in the hospital logbook and then that moves over to our registration officers. So it removes the need for our registration officers to come in contact with mothers who are directly impacted by COVID-19.
And that's it for JIS News today. I'm Lorraine Mendez. Thanks for watching.